Okay, I'm here for my appointment.
Test explanations. 1. Blood pressure check. Regular blood pressure checks help monitor heart health and catch early signs of hypertension, which can lead to serious conditions like heart disease or stroke, especially as we age. 2. Physical exam, annual. An annual physical gives your doctor an overall picture of your health, including important checks for skin changes, thyroid issues, and more, ensuring any concerns are caught early. 3. Complete blood count, CBC. The CBC test looks at your red and white blood cells to detect conditions like anemia or infections, helping maintain overall health and energy. 4. Urinalysis. This test screens for kidney health, diabetes, or potential infections, essential for early intervention in metabolic conditions. Cardiovascular health. 5. Lipid panel, cholesterol test. Even without risk factors like smoking or diabetes, cholesterol can increase with age, impacting heart health. Keeping it in check helps prevent heart disease. Reproductive health. 6. Pap smear and HPV test. These are essential for detecting early signs of cervical cancer and HPV, especially after 40 when risk factors for gynecological health change. 7. Pelvic exam. Regular pelvic exams help spot issues in your reproductive organs, like ovarian cysts or fibroids, and are important for general gynecological health. 8. Breast exam. A clinical breast exam can detect early changes that could indicate breast cancer, making it a critical routine check for women over 40. 9. Bone density test, DEXA scan. This test assesses your bone strength and checks for osteoporosis, which becomes more common as we age, especially post-menopause. Hormonal and menopausal health. 10. Thyroid function test, TSH, T3, T4. The thyroid regulates many body functions, and as we age, it's crucial to ensure it's functioning correctly, preventing issues like fatigue or weight changes. 11. Hormone levels. If experiencing menopause symptoms, testing hormone levels helps determine treatment options and manage symptoms like hot flashes and irregular periods. Cancer screenings. 12. Colorectal cancer screening. Starting at age 45, colorectal cancer screening is key to early detection. With no family history, you can choose from colonoscopies or less invasive tests. 13. Skin cancer screening. Annual skin checks are vital, especially if you have a history of sun exposure or concerning moles. Early detection is key to prevention. Bone health. 14. Calcium and vitamin D levels. Monitoring these helps assess bone strength and prevent osteoporosis, ensuring you maintain healthy bones as you age. Vision and hearing. 15. Eye exam. Regular eye exams detect vision changes and prevent issues like glaucoma and cataracts, which become more common after 40. 16. Hearing test. Hearing changes can occur subtly, so regular testing helps catch any issues early, especially as aging affects auditory health. Dental health. 17. Dental exam and cleaning. Biannual dental checkups help prevent gum disease, cavities, and ensure overall oral health, which plays a role in general well-being. Digestive health. 18. Helicobacter pylori test. This test checks for ulcers caused by bacteria, helping guide appropriate treatment.
What's treatment? Normal, that's great.
Yes. So after we've done weight,
height, BMI. We did ECG and pressure.
It's
And
normal.
all normal.
Yeah.
Thank you very much.
You're welcome.
Okay, so I've just had a full exam with my family doctor who I've met for the first time, and we went through a whole list of diseases in the family and anything unusual that I'm experiencing. Everything checks out fine. I need to do some bloods, and then I've got a follow-up on Saturday because some of the tests cannot be done today. And then I also need to bring in stool samples. It's got to be fresh, like within 1 or 2 hours. So the moment I get that, I need to make arrangements and let them know that I'm coming in to drop off the stool sample. Yeah, so the bloods are going to be to check bacteria in the stomach and a whole lot of other things that will be listed here. So stay connected.
Blood work consists of tests for 1. Lipid panel. 2. Fasting blood glucose. 3. Kidney function. 4. Complete blood count. 5. EBV Epstein-Barr virus, or EBV, is one of the most common human viruses in the world. EBV is also known as human herpes virus 4, and is a member of the herpes virus family. Most people will get infected with EBV in their lifetime, especially in childhood, and will not have symptoms. 6. HBsAg hepatitis B surface antigen. HBsAg hepatitis B surface antibody. HBeAg hepatitis B E antibody. HBcAg hepatitis B core antibody. These are to detect different antigens and antibodies related to hepatitis B, helping to determine infection status, immunity, or stages of recovery. HBsAg indicates active infection, HBsAb suggests immunity, HBeAb shows reduced viral replication, and HBcAb indicates past or ongoing infection. 7. Liver function, ultrasound and blood test. 8. Thyroid function, ultrasound and blood test. 9. Tumor markers, test for 5 kinds of tumors for females and 8 kinds for males. 10. Urinalysis, blood test and urine sample.
So while I'm waiting for my nurse to get back to me, because the next stop is the ultrasound. Ultrasound? Yeah, ultrasound. My family practitioners read my BMI report, and she says I need to put on some muscle because my BMI is a little bit low. But I do exercise and I do eat lots of proteins, but I don't know. I've got to double up on that. I've got no joint issues, no joint pain, nothing that I'm supposed to be having at my age do I have. Everything is 100% normal. With that check, I'm still going to have to get the bloods back, but I know that my bloods are going to have good results as well. I just need to increase my muscle mass and my protein intake. Alright, so I've had the ultrasound, which consisted of thyroids, breast, abdomen, and a pap smear. The thyroids were fine. Everything else was highly uncomfortable. Next thing I do is urine sample and stool sample. Since I don't have any stools for now, I'm gonna have to do that at another time, maybe tomorrow or so, and within an hour rush over to the clinic with the specimen. I want to see how that's gonna go. Okay, so I'm getting my bonus breakfast. Here's just a little bit of a cheese and ham sandwich. I did not want milk. I don't do milk. And my follow-up appointments on Saturday for ENT hearing. And the gynae. The thing that I had now, the ultrasound thing that I had now was not the pap smear. That's still to come. Okay, so oh, and there's an additional bonus. Let me tell you about this. The additional bonus is that
Thank you for coming along with me today on my health journey. Getting proactive about our health is key, especially as we get older. If you're in China or anywhere else, finding a reliable healthcare center and knowing which tests to prioritize is so important. And if this video gave you some insights or inspiration, give it a thumbs up and subscribe for more on lifestyle, health, and life in China. Let me know in the comments if you've had a similar experience, or if you have any questions about health screenings here in China. Stay healthy, stay empowered, and until next time on RJ's Antics, keep making your health a priority.
I can't wait.
Subscribe to RJ's Antics for loads more.